So I'm going to do a series now on the products of the fundamental 5, and I'm going to break these down. So I'm going to explain about the products, why I've prescribed it for you, and just so you're aware of the other products within the fundamental 5. So let's first of all talk about getting skin ready. Okay, so this is the essential step within the fundamental 5 to achieving healthy skin. It's a simple system of cleanse, exfoliate and tone. And as part of the Skin Gym, you'll be getting used to seeing me wash my face on a regular basis as a reminder to really work hard at this part and to ensure you spend enough time at each stage and perfect the application of the products. If you get this stage right, I can guarantee you will see changes in your skin. It's so fundamental to the skin health process, and that's why I'm going to spend a little bit of time on it today. The products are designed within the fundamental 5 to work synergistically to normalise skin functions and optimise the effectiveness of the active products that are used in the subsequent stages of your bespoke protocol called prevent and correct. And the prevent and correct stage is the stage that pushes your daily skincare into that therapeutic treatment by treating skin disease and disorder. So that's why it's really important to prep the skin surface by doing your GSR correctly. It's also why, to get the best out of ZO, we would recommend a full bespoke protocol rather than just buying the single products. And I'm going to run through the products now. So I'm going to talk through the cleanse phase. So there are 3 cleansers in the ZO Skin Health range: exfoliating cleanser, hydrating cleanser and gentle cleanser. And I'm going to go through each one in turn. Before I do that, however, just to go slightly off script, before I start talking about the products, one of the many things I enjoy about ZO is how it is just so literal, and it just does what it says on the tin. So the product names accurately tell you what they do, very straightforward and also very useful. And to avoid repetition, all 3 cleansers are effective at cleansing, see I told you, and that includes cleaning away any debris and oil, so any makeup. You don't need to use a makeup remover prior to cleansing. If you do wear makeup daily, then do a double cleanse if required, but I would prescribe that, and we talk about that during your consultation. Okay, so these cleansers are used AM and PM, and it's the first step in your protocol. Use a pea-sized amount on the tips of the fingers. Make sure your hands are clean before you start, and use warm water to apply to the face. Spend at least 60 seconds, up to 2 minutes sometimes, working the product all around the face and neck. Really go up into the hairline, or behind the ears, jawline, and of course don't forget the back of the hands as well, all the visible bits of skin. Rinse off with warm water and a clean flannel, or if in the shower, just rinse off, but please make sure the water is warm and not red hot. Okay, so exfoliating cleanser. So this is the most widely used prescribed cleanser in the range. We prescribe it for normal to oily skin, and it's a really nice cleanser. It has small blue beads contained in the gel of jojoba esters, which help remove skin clogging cells. It's got salicylic acid in, which is brilliant for targeting oilier type skins such as acne, rosacea, pigmentation. It exfoliates and decongests the skin and helps reduce inflammation. The second cleanser I'm going to talk about is hydrating cleanser. So this is really for normal to dry skin. It is the most gentle of all the cleansers, and we prescribe this really for genetically dry skin, so postmenopausal, for psoriasis, eczema type patient. We would always use the gentle cleanser in conjunction with a calming toner, and we use the hydrating cleanser for in-clinic ZO facials. It minimises dryness and irritation, soothes and calms sensitive skin. So this is the cleanser that, like, my mum would love, for instance. You can use this, like I say, we use it for in-clinic facials because you're not going to get any type of response with this. The third cleanser is gentle cleanser, and this again is for all skin types. So you can use gentle cleanser as a double cleanse. So the first step of, for instance, if you had a lot of makeup to take off, always use a gentle cleanser as a double cleanse. It's brilliant for that. Men can shave with it, children can use it. My 2 sons already use a gentle cleanser once a day. Twice a day would be asking too much really for them. But some patients do like gentle cleanser if they don't like the beads in the exfoliating cleanser. So those are your 3 choices. So I'm going to talk to you now about the exfoliation stage. So you've done your cleanse, 1 to 2 minutes. You're now going to move on to exfoliation. So there are 2 exfoliators in the range. We've got exfoliating polish and dual action scrub. The aim for both exfoliators is the same, and that's to remove all dulling, clogging, old skin cells and any other debris from the surface of the skin after cleansing, and to uncover those beautiful fresh new cells below. So how the 2 products do this is slightly different, and I'll run through that in a minute. So the aim is to use once per day, and the vast majority of patients will use in the AM. I keep a pot in the shower, so I use in the morning after cleansing. Some patients like to use in the PM as they can bring a slight heat to the skin, but it really doesn't matter when you do it. New patients will start off gradually, maybe once or twice per week, working up to once per day over 1 to 2 skin cycles. So I'm going to go through them individually now. So, exfoliating polish. So when new patients start on ZO, this is the product that they absolutely love. It comes in a beautiful blue glass pot with a beautiful blue magnesium oxide crystals, and it smells so good as well. So I'm just going to show you there. Can you see that? Yeah. I absolutely love it. It just smells so nice, just smells so clean. And patients say that their skin has never felt so clean, and this is the product that's largely responsible. So as we said, the aim is to use every AM after cleansing. You need a small pea size amount, and this is one of the ZO products that they actually ask you to measure out ourselves. Many of the Prevent and Correct products all come in pumps and are therefore measured out for us. So how does it work? It's a mechanical exfoliator which is suitable for all types, which means that we have to mechanically exfoliate. So you actually have to move the product around to remove the dead skin cells, and that's the magnesium oxide crystals. Is the hard substance within the products that does that for you. It also gently dissolves any oil, and as we know, or you will know in a minute, oil is the true enemy of the skin. So the crystals, if placed under a microscope, the magnesium oxide crystals have a molecular structure like a golf ball, with little hollows and indentations on the surface. And as the crystals are rolled across the face, not rubbed, rolled, these hollows remove the dulling, clogging skin cells, leaving the skin feeling and looking incredibly clean. You may also, as discussed, you may also feel a little heat to the skin, and if you use this product because it's got a small amount of tea tree oil in it, sorry. So I'm going to talk to you now about the second product in the exfoliation stage, is the dual action scrub. So this is used in moderate to severe protocols. It's used mainly for very oily skin type presentations such as acne type patients. I'm just going to show you a bit of the product. So it's white, and the beads in there in molecular size are slightly bigger than the exfoliating polish and slightly smoother, and I'm just going to run through why that is. Okay, so you'll find that some patients that are oilier type skin presentations will switch up to this at some point, and you can switch between the two, but I would prescribe that for you. But just so you know, you can switch up to that. The aim is the same as the exfoliating polish, to remove all the dulling, clogging skin cells and any other debris from the surface of the skin after cleansing. How it does this in 2 ways. Now remember, the exfoliating polish is just the mechanical exfoliation. This has chemical exfoliation as well as mechanical exfoliation. So the wax beads in the scrub are larger than in the exfoliating polish, and they're also smooth in chemical structure. So it's not going to knock the heads off any papules or any active breakouts and spread that bacteria. In addition, it also contains lactic acid and salicylic acid, which provide the chemical exfoliation by dissolving and removing excess oils and acne-causing bacteria. Brilliant. It's also got one of the unique redness reducing system in there, which is unique to ZO, which reduces redness and inflammation. So that's your second product within the exfoliation range. I'm going to talk to you now about the tone phase. So this is the final stage in your getting skin ready. So we've done cleanser, we've done exfoliation, we're now on to tone. So this phase is all about oil control, extra exfoliation, tightening pores and preventing breakouts, as well as prepping the skin both mechanically and chemically for the Prevent and Correct products, which come next, which deal with disease and disorder of the skin. So remember, GSR is prepping the skin for what's coming next. I'm just going to again go slightly out of lane now and talk about the sebaceous gland and the production of sebum and why oil control is so important. Okay, so the sebaceous gland is a microscopic gland in the skin which opens into the hair follicle, and it releases a fatty substance called sebum which secretes out onto the surface of the skin. These sebaceous glands occur in the greatest number on the face and scalp, but are also on all parts of the skin except the palms of the hands and the soles of the feet. So in simple terms, sebum is a complex fusion of lipids and fatty acids, which work to protect the skin by providing a protective barrier on the surface of the skin. Sebum plugs form when the sebaceous glands produce too much sebum or it's not well controlled and mix with dead skin cells and clog the pores. Too much sebum production is caused by a disorder of the sebaceous gland and can progress to chronic inflammation presentations such as acne and rosacea, or pigment conditions such as post-inflammatory hyperpigmentation. You may be familiar with some misconceptions about sebum or oily skins, and I know I've talked about this quite a lot with a number of patients, is that those with oily skin age more slowly. Wrong. Skin aging is not related to the amount of sebum, it's related to the amount of collagen and elastin produced in the dermis. Also, sebum keeps skin hydrated and prevents dryness. Wrong again. Dryness is due to a decreased amount of glycosaminoglycans, which is the GAG molecule, which is the water-binding molecules which increase hydration of the skin, and they also are essential in keeping epidermal and dermal cells healthy and keeping collagen and elastin in good condition. Dryness is also due to a compromised weakened barrier function, which allows increased transepidermal water loss. Now I'm going to talk more about barrier function and transepidermal water loss when we come on to the protect and correct phase, so the daily power defense and why that's so important. So that's coming next. But back to the 3 products now. Right, so we'll talk about the products now. So there are 3 products available in the ZO Tone phase. We've got complexion renewal pads, oil controller pads, and calming toner. And I would say that when you start on ZO, this is the stage that can be unpleasant to begin with and may cause a little sting. Now, one of my very good friends calls it the bathroom dance, and you'll know about it when you first start on it, and you will be doing a little bathroom dance. Now, the frequency of the tone phase ideally is twice per day, AM and PM. So in the AM, after your cleanse and exfoliation, and in the PM, we don't exfoliate, we just cleanse, tone, okay? And then your protect and correct phase. So it can take a little while to build up to this phase, but we will guide you through it. So we're going to go through the products one by one. So the first product is complexion renewal pads. These are prescribed for mild to moderate protocols. So again, the vast majority of patients will be on complexion renewal pads, but by far the most popular product for me to prescribe for normal to oily skin, and they can take a little bit of getting used to. So they come in a pot. There's 60 pads in a pot, and the pads are waffle-like in texture and preloaded with liquid. Okay, now, did you notice that the pads are designed to hold enough liquid to cover 5% of the body surface? So if you think of your palm as roughly 1% of the body surface, then your face is roughly 5% of the body surface. So again, they're perfectly proportioned to do the face, okay? Again, ZO's doing all the thinking for us. The texture of the pads allows a solution to penetrate and then to help exfoliate pore clogging dead skin cells to minimise surface oil. 2 acids in there, salicylic and glycolic, and that helps break down and remove oil from the skin, so that's the chemical process. You can always use this liquid as a breakout treatment as well by dipping a cotton bud in and dabbing on the breakout, but do not put the cotton bud back in, okay? I know all your tricks. Another trick, pads are single use, and you start on one side of the face, wipe down, being careful to avoid the eye and lip and neck area when you first start. Flip the pad and do on the other side, okay? Now, do not cut them in half, do not cut them in a quarter. I know all your little secrets, and I'm going to tell you why that's really, really important, because these pads allow me to see how you're getting on with your protocols, because they're a bit of a giveaway. There's 60 pads in a pot. Protocol is AM and PM. So if you're adhering to your protocol, then really you should be ordering 1 pot per month. And honestly, it's just like a personal trainer checking on how many takeaways you've had that week. This stage is just so critical and so important, and we've discussed why oil control is so crucial to your skincare results. So if you want to use 1 pad a day, fine, then your results are not going to be as good because your oil control is not going to be as good as if you were to stick to protocol. Same as if you have a few cheat days when you're eating healthy and you're paying for a personal trainer. The choice is absolutely yours and your results will be slower and not as effective, but again, that is down to you. We prescribe these in mild to moderate protocols, again, so as I said, normal to oily skin, so non-diseased skin. And in non-diseased skin, the benefit of reduced oil is that it allows for even penetration of active ingredients. It increases the efficacy of the topical actives, and pores will shrink and become smaller and more uniform, giving a better textural appearance. Another bonus is less oil means that makeup will go on better. Although many ZO patients find they need less and less makeup as their skin gets more healthy. The pads also prevent breakouts and provide antioxidant and anti-irritant benefits. It's a really brilliant product. So I'm going to talk to you now about the second product in the tone phase, oil control pads. These are for moderate to severe protocols. These are the pads are the next stage up and prescribed for a more diseased presentation of the skin, such as acne, rosacea or pigmentation. Same as the complex renewal pads, so we can measure in the same way, 60 pads in a pot, and the pads are waffle type in texture. Application exactly the same as complex renewal pads. This time, however, the solution contains 3 acids, 2% salicylic for acne prevention, and glycolic and mandelic acid, which help exfoliate the skin clogging cells. They're stronger than the complexion renewal pads, and like we said, will only be prescribed for a disease type skin. And the last product is a beautiful product called Calming Toner. It's really nice. It comes in liquid form, so you do need to apply this with a pad or cotton wool ball, which you have to provide yourself. It's only prescribed for genetically dry skin, so eczema, postmenopause, for instance, where sebum production is intrinsically compromised. I also prescribe this for a week or so after some in-clinic treatments such as skin needling. It just prevents that stinging phase and allows you to continue with your skincare. It can also be used as a patient is on a retinol program and is in the reactionary phase, so going through the redness, peeling and dryness phase, again allowing the patient to continue with daily skincare until they have moved past this phase. If I prescribe this on a protocol, it's normally in conjunction with a hydrating cleanser. It only has glycolic acid in which allows for a gentle and subtle exfoliation, which means no downtime and balances pH to restore skin health. Okay, so we've talked through the getting skin ready. Cleanse, exfoliate, tone. And I'm just going to sum up getting skin ready by using a nice analogy, because those that know me know that I like a nice analogy. And I just want you to picture this. So I want you to think about your cleanse, exfoliate, tone. And I'm going to use the analogy of when you're cleaning a high chair for a young child. So imagine you've got a weaning child to sit and have lunch. And imagine you've got to find that high chair in a busy soft play. Now, you will be laughing if you've ever been to a busy soft play. Imagine it, pre-COVID, it's a November Saturday, it's raining outside, and all of the population seem to want to come to that soft play. And all of a sudden, there is one high chair that's free. It is being vacated by another small weaning child that has left all of the weaning food on the high chair. Imagine that high chair is your face, is your skin at the end of a long day where you've been presenting with loads of makeup on and it needs cleaning. Okay, so you've got the picture. Now, cleansing is you clearing away the high chair of old plates, cutlery, cups, leftover food. You are removing debris, okay? It's clean. Exfoliating, what you have got is some little bits of food that are stuck onto that high chair. You're not having that before you put your weaning child in there. So you're going to scrub it off. So that's your exfoliating. You're going to have a little go, get all the carrot and whatever else is on there, scrub it off so it looks clean. Now, the tone phase, the most crucial phase is the anti-bac wipe, okay? So that you are going to have a clean high chair before you put your toddler in, right? Or your weaning child. The anti-bac wipe will make sure that it is clean and prepped and safe to put your child in so you can feed your child and they can eat off that surface, okay? Now imagine that you don't do your cleanse, exfoliate and tone phase right every single day. Then you put your Protect and Correct products on top of a face that isn't prepped properly. You're sort of not going to get the best benefit of the products that come next. So I want you to always think about that high chair, the cleansing, the exfoliating, the toning, clearing the debris, scrubbing off the dried off food and anti-backing the surface before you then are able to use that high chair. So I want you to think about that and really think about this GSR stage. And this is why I bang on about it all the time with the Fundamental 5. If you get this stage right, get your GSR right, then you get the best benefits from the products that are coming next. And really, if you get these 5 products right, you are going to get results. So I'm just going to leave it there. I want you to think about that analogy every time you wash your face, and I'm just going to leave that with you.